According to research, worryingly, only 1 out of 10 of us would act to administer CPR on a child. The main reason for this is that 3 out of 5 parents worry they may do something wrong, and almost half of all parents fear they could cause more harm than good. But imagine you're out shopping or on your way to work and you see a child collapsed in the street. They're unconscious and they're not breathing. What would you do?
We may be the experts when it comes to first aid, but dealing with resuscitation is something that anybody can do. It may seem complicated, but it's actually really easy to learn and it could potentially save someone's life. CPR, or Cardiopulmonary Resuscitation, is a combination of chest compressions and rescue breaths. Chest compressions help to move oxygenated blood to the brain and around the body in the absence of circulation, and a rescue breath is a breath that you create by blowing into the mouth of an unconscious child or baby. The method is actually really straightforward, but there is a slight difference in approach between administering CPR to a child and CPR to a baby. For a baby up to the age of 1 year, to check they are breathing, you should open their airway by placing one hand on the forehead and gently tilting the head back and lifting the chin. Then look, listen and feel for breathing. If they are not breathing, place your mouth over their mouth and nose and blow gently but steadily, attempting 5 initial rescue breaths. Then place 2 fingers in the middle of their chest and press down to 1/3 of the depth of the chest. After 30 chest compressions, give 2 further rescue breaths. As with a baby, to check if a child is breathing, you should open their airway by placing one hand on their forehead and gently tilting the head back and lifting their chin. Then look, listen and feel for breathing. If they are not breathing, pinch the child's nose and place your mouth over their mouth and attempt 5 initial rescue breaths. Place your hands on the centre of their chest and with the heel of your hand, press down 1/3 to the depth of the chest using 1 or 2 hands. After every 30 chest compressions, give 2 more rescue breaths. Ideally, you would continue with 30 chest compressions followed by 2 rescue breaths until the emergency services arrived, or if the child started to breathe normally again. If for whatever reason you can't do the rescue breaths or you don't want to, then it is okay to just do the chest compressions.
Hopefully you will never find yourself in a situation like this, but if you do find yourself in a position where you have to respond to an emergency situation, then these simple safety tips from the Tesco Baby and Toddler Club Baby Safe campaign could really help and even save a life.
For more information about first aid training, visit redcrossfirstaidtraining.co.uk.